Shock is a life-threatening medical emergency. Cardiogenic shock is a condition in which the cardiac output is reduced significantly to cause impairment of tissue perfusion in the presence of adequate intravascular volume. There are several known etiologies of cardiogenic shock, but we will focus on a few that may quickly be diagnosed at the patient's bedside with the aid of ultrasound. Please note that a diagnosis of shock cannot be made with cardiac imaging alone. A diagnosis of shock must take into account other clinical findings. It is important to assess left ventricular contractility in order to determine the amount of intravenous fluid the patient's heart can tolerate during resuscitation. Too much fluid administered to a patient with a poorly contracting left ventricle will worsen his or her condition. The overall contractility of the left ventricle can be quickly assessed in the left parasternal long axis view. Additionally, the apical four-chamber view can provide greater information about the state of the left chambers of the heart and provide a good comparison with the right ventricle. This parasternal long axis view demonstrates normal contractility of the left ventricle. The left ventricular wall and septum are contracting, and the left ventricular chamber is variable in size. In this patient with poor left ventricular contractility, the motion of the left ventricular wall is markedly reduced. There is little or no change seen in the size of the left ventricular chamber during the cardiac cycle, suggesting reduced ejection fraction or cardiac output. Variance of less than 30% at the level of the mid-ventricle is indicative of reduced LV function. In some cases, the left ventricle will assume a globular shape. Cardiac tamponade is a life-threatening condition that could be due to filling of the pericardial sac with fluid. Cardiac tamponade is diagnosed when the right ventricle is compressed completely or collapses during diastole. Additionally, the heart swings back and forth during the cardiac cycle. Cardiac tamponade is a medical emergency and is an indication for urgent pericardiocentesis to be performed under ultrasound guidance to relieve pressure on the heart. Acute large pulmonary embolism, or PE, can lead to strain on the right ventricle. This will lead to right ventricular dilation and hypokinesis. Right ventricular dysfunction has been established as a predictor of increased likelihood of death from pulmonary embolism. Moderate to severe right ventricular dysfunction can be effectively assessed by the presence of one or more of the following: ratio of right ventricular end diastolic diameter to left ventricular end diastolic diameter greater than 1:1. Right ventricular and diastolic diameter greater than 30 millimeters. Paradoxical right ventricular septal motion. McConnell's sign.